Welcome to the Docsubs Diary, guys. Today we are diving into something incredibly common topic. We are talking about worm infestation. Our main guide for is the standard treatment guidelines from the Indian Academy of Pediatrics. Yeah, let's get into it. When we say worms, we are not talking about the ones in your garden compost heap. We mean helminths. These are multicellular organisms, basically parasitic worms. They fall into two main groups. Roundworms, that is Nemathelminthes, or flatworms, Platyhelminthes. Simple categories fundamentally, and here's where it gets. And the most common types found in India is the Ascariasis, the roundworms, is number one about 52% of cases. Then you have got hookworm around 42% and whipworm trichuris at about 5%. So let's list the main players we will be talking about. There is a roundworm Ascariasis lumbricoides, then whipworm Trichuris trichuria, then hookworms. There is two main types, Ankylostoma duodenale and Nicator americanus. Then tapeworms Tinea saginata and Tinea solium. And then lastly Echinococcus, and the one many parents might know is the pinworm Enterobius vermicularis. Well, really eye-opening. Just how common are they? Our sources says nearly one-fourth of everyone on the planet is affected. Huge number, almost 2 billion people, and it hits children in low and middle income countries the most. And looking specifically at India, the force pulls together data from I think 127 surveys, shows an overall prevalence of over 20%. That's why the WHO classifies India as a moderate risk. 20%. But it gets even more specific. Studies from India's Ministry of Health and Family Welfare shows this huge range, sometimes as low as 12.5%, sometimes as high as 85% prevalence in certain areas. 85%, that is an incredible variation. Now let's talk about symptoms. You think having worms will be obvious, right? But here is the twist. Most cases are actually pretty mild, sometimes completely asymptomatic. You might not have a clue exactly. That's a key point. But when the infestation gets moderate or heavy, that's when the real trouble starts. And we are talking things like stunted growth in kids, serious nutritional problems, because the worms are basically stealing nutrients, right? They divert nutrients, can cause loss of appetite, damage the gut lining. It's a real drain, and that even lead to kids not doing as well in school. And the specific symptoms, they can really vary depending on the worm. It's almost like each one has its own calling card, which helps with diagnosis. Take roundworm. Scars, you can get something called Loeffler syndrome. Loeffler syndrome, what's that? It is a temporary lung thing, almost like an allergic reaction in the lungs. When the larva migrate through the lungs, sudden wheezing, trouble breathing, cough, fever, and then in the gut, ascariasis can cause abdominal pain, bloating, nausea, sometimes diarrhea. And in really bad cases, you can get a whole mass of worms blocking the intestine or even intussusception, where the bowel telescopes in on its own perforation. Yeah, very serious. It can even trigger allergic reactions like a rashes. And what about hookworm? Hookworm often start with ground itch. It is it's this itchy rash usually on the feet where the larva burrow into the skin, right? Walking for barefoot exactly. But the really big issue with hookworm is chronic anemia. It's insidious. Think about this. One single hookworm can cause about zero point zero 0.03 ml of blood loss per day. Sounds tiny, right? Seems like nothing, but multiply that by hundreds of worms day after day, it leads to significant iron deficiency anemia, even swelling from protein loss. Then tapeworms like tinea often just vague abdominal discomfort, maybe some itching. But the thing that really gets people's attention to that seeing actual segments of the worm, the poglotids in the stool or underwear, that can be quite distressing psychologically. And this brings up really important point with one specific tapeworm, the pork tapeworm, Tinea solium. It's a larva, and how can a worm larva end up affecting the brain? Well, that's exactly what happens with neurocysticercosis. The pork tapeworm larva travel through the bloodstream and form cyst in the brain, and the consequences can be severe. Seizures are common, focal or generalized. It can cause hydrocephalus, which is fluid buildup in the brain, vision problems, damage to the eyes. It's a major neurological issue in many parts of the world. Okay, now we form trichuris with heavy infestation. V-form can cause something called trichuris dysentery syndrome. Basically, inflammation of the colon. painful, straining, and sometimes, especially in kids, rectal prolapse. Okay, and finally, the common is the pinworm. Pinworm enterobius vermicularis, classic symptom, intense itching around the anus. The pruritus ani usually works at night. Nighttime is exactly leads to irritability, difficulty sleeping, very common in kids. So quite a range of symptoms from nothing at all to really severe problems. But what about echinococcus? It forms these large fluid-filled cysts, usually in the liver or lungs. Symptoms depend on where the cyst is, but can include pain, vomiting, a feeling of fullness, maybe chronic cough if it is in the lungs, and big risk if the cyst ruptures. That can cause severe, massive allergic reaction, even anaphylaxis. Given all that, how do you doctors actually figure out which, if any of these invaders are present? How do you diagnose them? Well, the cornerstone, the main method is still fecal examination. Looking at stool sample under the microscope, looking for eggs or the worms themselves. Primarily eggs or larvae, sometimes you might see adult worms or segments, especially with tapeworms. Ascaris, the roundworm, is often quite easy because get this a single female can lay up to 2 lakh eggs per day. 2 lakh, no wonder that is easy to find exactly. Labs use techniques like the formalin ether method to concentrate the eggs. Now, pinworm is different. The female migrate out at night to lay eggs around the anus, not usually in the stool. So for pinworm, you use a perianal swab or even just a piece of sticky sellotape press around the area first thing in the morning to pick up the eggs. Clever. And there are other clues besides looking at stool, like in blood test. Yeah, blood test can help. One thing we often look for is eosinophilia. That's a higher number of specific type of white blood cells called eosinophils, which often increase during parasitic infection and especially with hookworm, like we discussed, you'll often see signs of anemia in the blood count, especially microscopic hypochromic anemia, small pale red blood cells due to iron deficiency. That makes sense. And what about newer methods? I hear about molecular test, right? PCR, polymerase chain reaction. These are much newer and definitely offer advantage that are generally more sensitive, especially if the number of eggs is really low, maybe below what you can reliably see with the microscope. So better detection for light infection, and PCR can often detect multiple types of elements from just one sample and even give an idea of the quantity, the worm burden. That sounds really useful. It is. And what about looking inside the body imaging? Imaging definitely plays a role. For instance, if someone has an intestinal obstruction caused by a big ball of scarce worms, yeah, you mentioned that possibility, and X-ray might show what's described as a cigar bundle appearance or whirlpool effect. You can literally see the mass of worms. And ultrasound is a fantastic because you can sometimes see the worms directly. You can locate roundworms. For example, if they have migrated into the bile duct, they might show up as a bullseye sign or a double tube sign. You can actually see the worms on ultrasound. You can't also really important for finding and staging those hereditary cysts or using the WHO classification system. And then for more complex situations like neurocysticercosis in the brain or deep high hereditary cyst, CT scan or MRI gives much more detailed picture. So whole a toolkit for a detection. So once you found them, how do you get rid of them? What are the treatments, right? Fighting back. Use anti-helminthic drugs, anti-worm medications. They generally work in a few main ways. You have the benzimidazoles like albendazole and mebendazole, and they basically damage the cells of nematodes. Then you have drugs like parental pamoate and levamisole, which cause spastic paralysis. The worms contract and can't hold on, and others like piperazine cause flaccid paralysis, making the worms let go. So there is a different ways to disable them. So how does this apply to the specific worms we talk about? Let's start with roundworms, Ascaris. It is usually oral albendazole or mebendazole. Very effective, but if you have that severe intestinal obstruction, the ball of worms, yeah, then the approach is changes. Often, piperazine citrate is given sometimes through a nasogastric tube to paralyze the worm so they can pass. Surgery is really a last resort if that doesn't work, and the lung symptoms, the Loeffler syndrome, yeah, that usually self-limiting. It resolves on its own. You don't typically treat. Then for a hookworm, again albendazole, the mebendazole or parental pamoate are the go-to drugs. But rid of them completely can sometimes take more than one dose, and one species, Nicator americans, can be a bit tougher to treat. Single dose mebendazole might only cure about 10% of Nicator infection, sometimes only 10%, so repeat treatment might be needed often. And now for whipworm, albendazole is preferred, but here is the catch. Single day treatments often have pretty low cure rates, maybe only 28 to 36%, and the effect might not last. So longer courses might be needed for heavy infection, right? And adult tapeworms. For the adult tapeworms living in the gut, usually praziquantel or niclosamide. But what about the really tricky one, the pork tapeworm larva, Tinea solium, that causes cysticercosis, and the beef tapeworm, Saginata, that usually don't cause disease in humans, so it's a very important distinction. So for a neurocysticercosis, the first step is managing the symptoms, anti-epileptic drugs if there are seizures, treating hydrocephalus if it's present, then you consider anti-parasitic therapy, usually albendazole. Sometimes praziquantel added, but because killing the cyst can cause inflammation in the brain, it's often given along with the corticosteroids to dampen that inflammatory response. And if there is a obstructive hydrocephalus, neurosurgery is often essential. So it's a multi-pronged approach. And definitely for echinococcus and its hydatid cyst, management is also vary, depends on the cyst, stage, size, location. Option include long courses of albendazole, a procedure called PAIR. It's a percutaneous aspiration, injection, re-aspiration to drain and kill the cyst. Surgery for complicated or large cyst, or even just careful monitoring, watchful waiting for inactive late stage cyst. Lots of option there. And the pinworm, the itchy one. Pinworm is usually straightforward, albendazole, mebendazole or parental palmoid. The key thing here is repeating the dose after 2 weeks. But why the repeat dose? Because the first dose kills the adult worms, but not necessarily the eggs. The repeat dose catches any worms that hatch from eggs that were around during the first treatment, and often treating the whole family is recommended because it spreads so easily, and that makes sense. And beyond individual actions, what about the bigger picture stuff? Public health efforts. I know India has a major problem. Yes, and India also has a major program, the National Deworming Day, launched in 2015. It's a massive undertaking. It's a fixed date program run through schools and the Angadwadi centers, the preschool centers. The goal is to deworm all children aged 1 to 19 years across the entire country on a single day. All children 1 to 19, that's ambitious. Usually ambitious and largely successful. It happens every year in February 10, and then there is a mop-up day on February 15 for kids who miss the main day. Some states with higher worms prevalence usually do it twice a year, adding around in August. And what drugs do they use for this mass treatment? They use albendazole. It considered very safe and effective for this purpose. The dose is 400 milligrams for kids aged 2 to 19, and half that 200 milligrams for the little ones aged 1 to 2. That's a huge public health success story. It really is, and aligning well with the WHO recommendation for controlling these worms at a community level. WHO suggests that in areas where the infection rate is low, say less than 20%, doing individual testing isn't really cost effective. But if the prevalence is over 20%, they recommended annual mass treatment like India does. And if it is really high over 50%, they recommended treating twice a year. So there is a clear strategy based on risk levels, exactly targeted public health action. And with that, I think we bring this deep dive to a close. We have gone from understanding just how hidden and widespread this worm infestation, and sometimes in surprising ways they infect health, and then through the whole process of diagnosis, complex treatments, and finally prevention, both personal and public. Yeah, and thank you for watching, and please like, share, and subscribe to the DocSubs Diary for amazing content. Bye.